My name is Scott Gabrielsen. I'm a male reproductive urologist at UR Medicine. I think one of the things that makes me unique is that I'm a researcher at heart. So I have a PhD in biochemistry, and as a result, I like to understand why things are going on. And so as a result, that I think translates into a different way that I approach patients. I want to understand what is going on with them, what can I do to help them specifically. My particular interests are male infertility and sort of the reproductive system in general, in treating, diagnosing, and better understanding what is going on with the male reproductive system. Because as a researcher, there are a lot of opportunities to expand our understanding of what is going on and improve treatment. In male reproductive medicine especially, there is a big knowledge gap. Research is an important part of my overall practice, but I think it allows me to be a better clinician and allows me to offer my patients more. And when we don't have an answer, it allows me to say, hey, maybe we need to look into this further and maybe we need to find an answer. I like that a lot of what I do is happy moments. One of the patient stories that has stuck with me the most is I saw a patient who had infertility, and he had been trying for a while to have children, and we found a problem that was relatively easy to treat. And we discussed the treatment options, and he moved forward with surgery. And I got an email from him about 6 months later saying, hey, Dr. Gabrielsen, thank you so much. My wife just had her first pregnancy test, and after 2 years of trying, I don't know what to say. And so I think that being able to help people have those moments really makes medicine exciting for me. And it's, again, a lot of happy moments that I get to deal with patients.